Moore, owner of Total Performance Physical Therapy. Today we're going to talk about different types of knee pain. So usually when we talk about knee pain, we're talking about not necessarily the type, but the location. That usually determines a lot about what's going on at the knee. There could be several factors that are causing the knee pain, and we're going to talk about where you're going to feel that pain and what type of pain it could be. So the first place generally you'll feel pain is in the front of the knee. So this could be a tendonitis, a patellar tendonitis. Sometimes it's called jumper's knee, and it's common in runners, people who jump, although you don't necessarily have to do either one of those things to develop patellar tendonitis. You could have pain right below the kneecap when you have this. That's generally caused by a lot of different factors, hip weakness, sometimes the improper footwear. That's something that you really want to get looked at because you really want to figure out where that's coming from. It's not just a simple, oh, we're just going to fix that. And if somebody tells you that all they're going to do is fix your knee or fix that patellar tendon, that's not the correct way to treat that. So you do want to address all the factors that are causing that tendonitis. Another type of pain that you can feel in the front of the knee is the wearing away of the kneecap. So underneath the kneecap, you have some cartilage, you have some surface that doesn't really want to rub against the bones behind it. As we age, it's natural that starts to wear away, but unfortunately, sometimes it wears away a lot faster for people. So when you go to bend your knee, you can get a lot of pain. This is when we start to talk possibly about a knee replacement. But there could be, again, several factors causing that pain. So you want to make sure that you are addressing all the factors and not just rushing into a knee replacement. And one of the other things that could be causing the pain in the front of the knee is a tracking issue. So as your kneecap bends or as you bend and straighten your leg, your kneecap moves in and out of a groove. And if that tracking is off, that can cause some severe pain. It can cause tendonitis. It can also lead to that degrading of the surface of the kneecap. So you could have pain with that. Again, got to figure out why it's not tracking correctly. That's usually muscle imbalance, meaning some muscles are pulling harder than the others. So you definitely want to get that looked at and treated. It's not something that's just going to go away on its own, and it's really hard to diagnose a patellar tracking issue on your own. The next place you can have pain is obviously on the outside of your knee. When we're talking about that, we're talking about generally two different things. There is an IT band tendonitis. Again, that word tendonitis, anytime you hear that, it is not necessarily a specific diagnosis. It means overuse of a tendon and inflammation of the tendon. But why is that tendon getting overused? A lot of times it has to do with a failure all over as opposed to just right at the knee. So again, if you have that IT band tendonitis and all you're doing is addressing the IT band or the knee, you're really missing out on the actual cause of what's going on. Again, it could be foot issues, ankle issues, hip issues, back issues. A lot can go into causing pain on the outside of the knee. You're going to feel like going up and down the steps, but it is something that can be debilitating if it's left ignored. Runners can actually just stop in their tracks and not be able to run anymore if it's bad enough. And this is one of those things that comes on and you'll feel it and then it won't, and then you'll feel it and it won't, and then all of a sudden you feel it and it won't go away. So if you're experiencing that knee pain on the outside of the knee that's coming and going, you want to address that sooner rather than later, because one time it will come and it won't go away, and it will really stop you in your tracks. The next thing that it could be on the outside of the knee is a lateral ligament, lateral collateral ligament, and generally you're going to know if you injure that. That's really only a traumatic injury, a fall, somebody hits your leg, you're going to have either a tear in that ligament or you're going to have some type of injury sustained directly to that ligament. So if you don't know what you did to cause the pain, if you weren't involved in an accident, you didn't hit your knee, nothing really happened, generally it's not going to be that ligament. Then we have pain in the back of the knee, and that can be caused from a couple of different areas also. And that could be caused from a cyst that forms in the back of the knee. That could become caused from a bursa that's inflamed, a bursitis. It could come from some gastroc pain or calf pain or hamstring issues. It also could be coming from the back. So when you're dealing with back of the knee pain, that's a very broad place, and there's a lot that goes on in the back of the knee. So while you could just simply have an inflammation back there, or maybe just need to stretch the calf muscle, it could be a herniated disc that's sending signals all the way down into the back of the knee. It could be a bursa, it could be a cyst. So it's something, again, you want to really get diagnosed. Sometimes it hurts to bend the knee, sometimes it hurts to walk. There's not really one specific diagnosis that goes with, or one specific symptom that goes with one specific diagnosis. On the inside of the knee, you're going to look again at that medial collateral ligament. Again, that's something that you're going to have impact with. If you tear it, it's going to be an ACL tear where you're running and all of a sudden everything pops. It's going to be something that you feel the injury, something happened. It's not just going to be gradual over time. And then you have your meniscus. You have one on the inside, one on the outside of your knee. They're in the joint. They can cause a lot of pain. A lot of times when you plant and you cut, that's when you're going to feel those. So anytime if you're just walking up and down the steps and you're feeling that pain, a lot of times that's not meniscus, but if you're, having trouble moving or cutting, that's going to be more of a meniscus thing. And just because you have a tear doesn't mean that you're necessarily going to have surgery. It depends on where the tear is and things like that. But a lot of times with those meniscus tears, you are also going to have a traumatic injury, but not all the time. That was just a pretty short list of everything that can go on at the knee. The difficulty with the knee is that it's basically the hub. All the muscles at the hip come down and attach there, and then all the muscles from the foot and ankle come up and attach at the knee. So you can't really ever just address the knee. And if you are just trying to fix the knee, you're really going to fail at that treatment because you've got to figure out where it's coming from. And if you don't identify the source, you're going to continuously have problems. If you or someone you know is suffering with knee pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks and have a good day.